Last week, we talked all about digestion and breaking food down. This week, we're talking about all the next steps after food is broken down, absorption, and why is it important. Today's agenda: what is absorption? Why does it matter? How does it normally work? What happens when it's not working well? Medical standpoint of poor absorption, and doable, realistic tips to better absorption. Let's dig in. First and foremost, we have to ask the question, what is absorption? This is a process that happens mostly in your small intestine, a little bit in your large intestine, where your body extracts the nutrients from the food so we can use it. Why does absorption matter? To simply put, we need the nutrients in order for us to live and to function. And what's crazy about absorption is that it's not just about the gut anymore. The reason being, it's involved in so many other processes like our skin health, our immune system, our brain function, energy, detoxification, metabolism, energy production, hormones like our thyroid, our cortisol, our sex hormones like estrogen, testosterone, progesterone, so much more. Keep those in mind because they're going to come back around when we talk about when things go wrong. All right, so let's talk about how absorption normally works. Remember the small intestine? We're going to go right back to it. Our small intestine have these finger-like structures called microvilli and even smaller structures called microvilli. These are going to be very, very important when we talk about absorption process. So in absorption, there's about 3 parts. First step is something we already talked about from our last episode. When food gets broken down, it's broken down into these small little particles. The smaller that they are, the more surface area that they have, which is really ideal for that absorption. Step 2 is when that microvilli and villi come into play. They kind of act like a gate to allow nutrients to pass through the intestinal wall so that they can go to places that they need to. There's 2 places that the nutrients go to. One is bloodstream and then the other is lymphatic system. What the difference is that for water-soluble nutrients like glucose or simple sugars, amino acids, water-soluble vitamins, those go to the bloodstream. For fat-soluble nutrients, things like fats, things like fat-soluble vitamins, those go to the lymphatic system. And step 3, once those nutrients are absorbed, they go to places like our liver, other organs, cells, tissues for all the things that they need to do. As I mentioned, small intestine has the majority of the absorption, but there is some that happen in the large intestine. Those are more for water, minerals, and some vitamins. So then what happens when the absorption isn't working well? So unlike what we talked about in the digestion episode, there's more than just gut symptoms that someone can have when they're having poor absorption. So common signs and symptoms that we see: fatigue or low energy, hair thinning or loss, brain fog or concentration, memory issues, feeling weak, dizzy, headaches. We can also see a lot of hormone issues, whether it be thyroid, whether it be stress hormone. We can also see period issues if you are someone with female organs. We can actually see mood changes as well, whether it's low mood or anxiety. And we can also see skin issues, oftentimes acne, more wrinkles, kind of like a saggy, not so great or healthy looking appearance, even just looking dull. Okay, so what do we look from a medical standpoint when it comes to poor absorption? And this is just scratching the surface. As a naturopathic doctor, these are things that I keep in mind, but it can be beyond in terms of what I look for. When it comes to medicine, the first and foremost is we are looking for any specific condition or ruling out the specific condition that someone may already be prominent to having poor absorption. The common conditions that really come to mind are things like IBS, any form of dysbiosis, so SIBO, Candida, things like that, celiac disease, inflammatory bowel disease. Some of the lab tests that I look for are usually blood tests, some stool tests. There's also imaging tests like endoscopy, colonoscopy, usually through gastroenterologist. And as a naturopathic doctor, there are specialty tests that we use in both naturopathic and functional world to really look into how the gut is doing. One of the key things I do order for a lot of my patients is just simple blood tests that we look at the micronutrient status. The most common micronutrients that I see insufficient or deficient levels in a lot of patients is vitamin B12, vitamin D, iron or ferritin, and omega fatty acids. If it's really bad, sometimes I can even see anemia. And the crazy part is one of the common things I hear from other people is, oh, I don't have any gut issues, so therefore I must be absorbing all my nutrients really well. And then we test their labs and that is not the case. So what can be done for better absorption? As always, in naturopathic medicine, one of our principles is to find and treat the cause. In the meantime, these are also some of the things that I have people do. This is not medical advice. Please work with your healthcare providers to see if these are right for you. Just because it works for someone does not mean they work for everybody. First and foremost, if you already watched the last episode, you know this. Supporting digestion and the breakdown of food is going to be very crucial. Remember when I said the more surface area that we have of those food particles, the better? Making sure that we are properly breaking down those foods, making sure we are exposing as much surface area as possible so that there is less burden on the rest of the digestive processes. It makes it a lot easier for small intestine and large intestine to absorb those nutrients as well. Supplements do come in handy at this time. I usually have people start on digestive enzymes, especially if there's a little bit of ox bile, a little bit of betaine hydrochloride that really help with that breakdown. Bitter herbs are also really great in this portion too. Multivitamins. Usually I will put people on multivitamins. Just because we have a multivitamin on hand does not mean your nutrition and diet should go downhill as well. It is, again, supplementation, and especially while we are investigating to find the cause of this poor absorption. If we're talking specifically about minerals like iron, they are better absorbed with vitamin C. So when you are eating iron-rich foods, you're also eating vitamin C-rich foods so that we can really better absorb and enhance that absorption too. Eating the rainbow. That essentially means eating every color of the rainbow as much as you can in your diet. The reason being, when we talk about these rainbow and the things that really give the color to the vegetables, fruits, whatever you have, those are what we call phytochemicals or phytonutrients. Foods that are high in these phytonutrients, things like carotenoids, things like flavonoids, polyphenols, really enhance the absorption of our nutrients. Now we ask, is your body breaking down food and absorbing nutrients properly? Absorption has a profound effect not only in your digestive system, but also in every part of our body. And that's why it's so important. Next week, buckle up because we're going to be talking about gut lining integrity, gut microbiome. It's going to be a big topic. So make sure you subscribe and follow along. You don't want to miss it. If you have any questions from this episode or the last episode or anything that you'd like to see, make sure to leave a comment below. Thanks for watching. Bye.